We're encouraged by the continued progress we've made on COVID-19 with respect to our public health metrics, which allowed us to launch Step 2 of Phase 2 of our reopening process yesterday. We'll continue to monitor those key public health data as we move forward toward the next phase. I think, as everybody knows, Phase 2 started recently, and many new types of businesses started operating as a result. I know it's been difficult, to say the least, for all of those businesses and many of their employees, but thanks to everybody doing their part to slow the spread, many more people are getting back to work this week. Our public health team will collect data over the course of the next 2 weeks and monitor how things are going with respect to those key indices as more and more people get back out and about in their communities, and that will inform decisions we make going forward with respect to additional advancements. Now, as of yesterday, 937 people were hospitalized with COVID-19 in the Commonwealth, which is a 74% drop since April 15th, and 180 COVID-19 cases are currently in the ICUs in Massachusetts. That's also a very significant drop from the middle of April. Yesterday, over 6,700 new tests were reported from across the Commonwealth. 149 new positive COVID-19 tests were confirmed, which means the 7-day average for the positive test rate with regard to cases is down to about 1.9%, and that's a 93% drop since April 15th. Last week, as many people know, the Commonwealth offered COVID-19 viral testing for people who recently attended a large gathering, like the demonstrations and protests to honor George Floyd, and this morning we got the final results of that. Out of 17,617 tests that were conducted statewide, 2.5% came back positive for COVID-19, which is reasonably consistent with the statewide numbers that we see in our daily testing. We're obviously pleased to see that the percentage of positive tests was quite low, considering the frequency and the size of those protests and demonstrations. But we also pointed out that the vast majority of the folks who participated in those demonstrations were wearing masks or face coverings of one kind or another. Many cases they were moving, which I think made a big difference, and of course they all took place outside, which we all agree is a far safer environment than indoors. We're obviously encouraged by the continued progress we've made on many of those public health metrics and are going to continue to monitor them as we proceed through the rest of the reopening process. We do believe part of the reason we've been successful so far with our reopening strategy is due to the work and the efforts of everybody here in the Commonwealth to do the things that make a difference to contain the spread of the virus. Please continue to wear face coverings, practice social distancing and good hygiene, stay home if you're not feeling well, and seek guidance from your medical provider, either using telehealth services, which people here in Massachusetts have adopted enthusiastically, or by visiting them. Most of our healthcare providers at this point are now open and back in business. Keep in mind that COVID-19 will not take a summer vacation. Other states are seeing surges right now. It's a clear indication about how important it is for people to continue to be vigilant, and we want to avoid anything like that happening here in Massachusetts.